Especially on the human side, and always the veterinary side tends to kind of follow behind, but you're starting to see molecular diagnostics, so things like PCR actually become miniaturized in a way, so a benchtop analyzer that could get into practice. In fact, here at the Western Veterinary Conference, we already have a couple entrepreneurial type organizations that are here, trying to entice veterinarians to look at molecular. It's not, I think it's not the be all end all, but it definitely will help, especially for acute disease diagnosis. Again, having it on site rather than sending to reference lab. I think the other thing that is cool, but I haven't seen this yet, but I think it's on the horizon, is more and more with biomarkers, or what they call liquid biopsy. So biomarkers, trying to look for disease a lot sooner. So maybe it's something that's normally produced, but it might be in an extreme quantity or a lesser quantity, depending on what organ system may be affected. And that could help with earlier disease diagnosis or detection, and then potentially, what I might want to do as a veterinarian to treat that or mitigate its severity or progression. The other thing then would be liquid biopsy. So it's mainly for cancer. So instead of having to actually get cells or tissue from a tumor, would we be able to actually just measure in a blood sample circulating tumor cells, so CTCs as they're called, and that's definitely in the human space coming to fruition. So I think it's just a matter of time to see even that, and I think that would offer a lot, because we would save ourselves and our pets, or patients, pet owners, from going through to actually get tissue to make a diagnosis.